Hi, it's Mike Putman, coming from ACR 2019 for Room Now. I wanted to talk briefly about the TULIP trials that are being reported at this meeting. It's exciting. They assess the treatment anifrolumab, which is an interferon inhibitor in lupus. The first TULIP trial failed to meet its primary endpoint, which was the SRI-4. In a post hoc analysis, they found that it actually did meet the BICLA analysis, or it did meet BICLA as an endpoint. You only need to treat 6 patients to get there, so it actually seemed like a reasonable thing to do. That's post hoc. You always have to be careful of those kinds of analyses. The next TULIP 2 trial is expected later today, and early indications are that that was a successful trial, and it used the BICLA. So what's the difference between these? Well, the SRI-4 requires a total improvement in some domains, whereas with the BICLA you can get a little better in all across the board to meet that endpoint. So I think that might be part of why one endpoint seemed to work whereas the other doesn't. The really important question for me is what matters more to patients? Does one of these endpoints really reflect what is the endpoint that shows your patient is doing better? And I have not seen anything convincing along those lines. That will remain to be seen. So be sure to check out the next session for TULIP 2 later this afternoon at 4 p.m. For any more information, please go to roomnow.com.